This is an interview with Ellen Nelson, an RN that I have worked with for many years. Ellen, I'm going to ask you a few questions. How long have you been a nurse?
I've been a nurse for 57 years.
And over all these years, how many changes have you seen?
Well, number one, the dress has changed for nurses, which it has changed for all women. And we only wore skirts, and we always wore a hat. And hose. We were properly dressed, and now it's all slacks.
That has changed. I wore my cap when I graduated, actually. You don't see any of that anymore. When you worked, did you work on med-surg or ICU? Have you been to all the departments?
I have been to all the departments. I've never worked in surgery. I did about 6 weeks of surgery in training, but other than that, I've never worked here in surgery. But other than that, I've worked in home health, hospice, peds, 4th floor, critical care, psych.
What would you say
recovery room?
What would you say is your least favorite area?
Psych.
Now,
and we had an alcohol program, and that was one of my least favorites also. Yep.
Yeah, they kind of did away with it. They just sent them to the general floor now. When you worked back when you first started, what would you say was the amount of patients you had per nurse?
Probably about 15 per nurse when I worked up on 4th floor, because we divided the floor into 4 sections, and we had a nurse in each section. Yeah, but we had aides helping us then too, and charting was different. No computers. Yeah.
And in that 8-hour shift, I know that patients today, would you say their illnesses and their hospitalizations are worse than what they were 50 years ago?
Absolutely. 50 years ago, a person had a barium or GI, a series of tests, they brought them in and let them stay overnight. We don't do that today. There were a lot of patients that were up patients, and we don't really see that today. They're very sick patients now.
Yeah. Now, back then, doctors, there weren't as many specializing doctors. It was more general practitioner.
Correct.
And
I don't remember cardiology. We had surgeons, general practitioners.
And did the general practitioners do surgery also?
Some, yes, yes.
When you went to school, was your education at a college or was it at a nursing facility for schooling?
When I went to school, I went to the University of Iowa, which still, of course, has nursing, and I have been back there since to see it. And we started out with just general and lived in the regular dorms. The last 2 years we lived in the nurses' dorm, and that was all nursing then.
When you decided to become a nurse, did someone push you that way, or did you always want to be a nurse?
I didn't know what I wanted to be. My mother was very influential in my life, and she was not a nurse, but she came from Iowa City, where the University of Iowa was, and I took the test, passed it, and went to nursing school. I have a sister that's younger, and she became a teacher. And I don't know why I chose nursing over teaching, but I don't remember.
Do you have any regrets?
No, I absolutely love being a nurse. And that's why I'm still here at the age of 78.
Well, we appreciate you. You're awesome. You're my inspiration. When you see the new nurses coming out now, what would you say is the number one thing we need to make sure we let them know that we need in our nursing field?
again, I would say the most important thing that I've learned over all the years is to listen to your patient. And I think that's the most important thing that I do, that I've changed probably. When I was younger, I felt I knew quite a bit, and now I know I don't. But if they tell me something, I really do listen to them.
And your patients always enjoy you, Ellen. I know they always ask. If you're not here and they've had you before, they are genuinely pleased when they do get you. Well, thank you for this interview. I appreciate it.